Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Heart disease is the number one killer in America. Every year, 1 in 4 deaths is caused by heart disease. Heart disease encompasses a wide range of conditions that affect your heart, including disease of the blood vessels that supply the heart and heart attacks.
The term heart disease is often used interchangeably with the term cardiovascular disease. Cardiovascular disease generally refers to both heart problems and blood vessel disease that can occur anywhere in the body. In an effort to raise awareness and promote prevention, February is recognized as American Heart Month. And here to discuss is Mayo Clinic cardiologist, Dr. Stephen Kopecky. Welcome back to the program, Dr. Kopecky. It's good to see you.
Thank you for having me.
If it's such a big problem, why does the shortest month get devoted to it?
Well, at least we get a month.
Okay.
It's not a day.
28 days. You know, it's always good to have you on the program because we all know that heart disease kills more Americans than anything else. It accounts for 1 in 4 deaths. But why the heart? I mean, I know everybody, you have to die of something, but we've got all these organs that can go bad. Why is it often the heart?
Well, the heart, if it doesn't beat blood to your brain within 6 seconds, you pass out. That gets our attention very quickly. If your bowel stops up, it's a few days. You know, if your kidneys don't work, it's a week. You know, if your lungs don't work, it's a few minutes. But the heart gets our attention very quickly.
Would you say that we're doing better in terms of, are there fewer people dying of heart disease than a decade ago?
Clearly there are. The prevention efforts, both treating diseases and the diseases that cause the heart attacks, are both getting better around the country.
All right, the number one heart disease, coronary artery disease, correct? Explain what that is.
Yeah, coronary artery. Coronary is another word for the heart. Artery is the tube that carries blood to the heart. And disease means it starts to get narrowed. We've heard the term hardening of the arteries, and that's a very real term because we get calcification in our arteries, and if you take them out and feel them, they feel like little bones. And what happens is the artery plugs up. As it gets narrowed, not enough blood to the heart muscle, and then you have a heart attack.
Coronary artery disease is so common. There are big arteries that supply the heart, but if you have a coronary artery disease, are you also likely to have disease in your other blood vessels, like the ones that go to your brain or your legs?
Yes, it's very interesting. If you look at other arteries, say you have a narrowing of the artery to your head, it's very likely you're going to have a narrowing of the artery to your heart. If you have a narrowing in the artery to your in your abdomen or to your legs, very likely to have a narrowing in the artery to the heart. But the biggest correlation seems to be the penile artery function or dysfunction. If your penis arteries don't work well, it's very likely you have heart arteries that don't function properly also.
You have said in the past that that is the fact that sometimes gets patients in to see you more than, oh, you could have some heart problems.
Right. And we call it the canary in the coal mine, meaning that the artery problems that cause erectile dysfunction precedes heart attacks by about 3 years. And there's really no other relationship like that within the body arteries. So it's a big issue.
It doesn't necessarily mean, though, that if you have erectile dysfunction, you have heart disease, does it?
If you're a man who's 70 years old, no. If you're a man who's 40, and your erectile dysfunction is not due to prostate surgery or something, then you have a 50 times greater chance of having heart disease than another person just like you without erectile dysfunction.
Age, did you say age 40?
Yeah, in the 40s.
Age 40, erectile dysfunction, how much is your increased risk of heart disease?
50 times greater than someone else just like you that doesn't have ED.
So anybody age 40 with ED ought to come in and see you.
They should see somebody, right?
I'd say 40, 50, 60, probably. If that is a problem, you should see someone, no matter what.
Risk factors for coronary artery disease. Who's at risk?
Well, you know, the number one risk factor now is diet. And it's interesting.
Really?
It's past smoking.
More than smoking?
Well, smoking has gone down. There's been a big reduction in smoking in the last 20 years, I think due to educational efforts and taxes, et cetera, that have gone up. Because 90% of smokers start before age 18, and if you can stop them, they don't start later. That's a big deal. The hypertension, high blood pressure has come down. Our activity patterns are still quite low. We're not very active physically, but and our cholesterol numbers have gotten better, amazingly, around the country.
Statins,
and I think people are eating a little better. They're starting to become more aware.
So, but diet is the number one risk factor.
Diet is the number one risk factor. And you have to remember that 56% of the calories we eat in this country are due from 7 food groups that are subsidized. And we all know what those food groups are, corn and beans and meat and dairy, et cetera. And the more we eat of those, the more likely we are to have high blood pressure, the more likely we are to have heart disease, the more likely we are to have diabetes, the more likely to have obesity. And so I think people are starting to learn that fruits and vegetables are actually good for you. And let's eat something fresh.
Wait a second. Now, when we were getting started, you were saying more likely to have diabetes, heart disease, these different things. And then you just left off right now what was on the list, what you mentioned before we got started, because it really perked my ears up. So you also said women's sexual health can be affected by diet. Is that what you said earlier?
Yes, that the Mediterranean diet, as we define it here at Mayo, which is a very specific 10 do's and 4 don'ts. The do's are olive oils, fruits, vegetables, fish, some nuts. The don'ts are a deck of card of red meat. You only get a pat of butter a day. Only get processed foods 3 times a week, something out of a box. That will not only lower erectile dysfunction, but it's the only diet shown to reduce female sexual dysfunction.
That's amazing.
Really?
See?
Well, now everybody's listening.
Well, when we get there's erectile dysfunction, your ears pop up. My ears perked up for that one for some reason or another.
All right, coronary artery disease. If it gets bad enough, one of those arteries, what are those? 3 main ones, right, that supply the heart muscle. One of them gets blocked, you have a myocardial infarction or a heart attack. Tell us how good you are at treating that now and how soon you have to get to the hospital for you to do something that'll help.
Yes, good question. The treatment has gotten great. Within 30 to 60 minutes of coming to the hospital with a heart attack we call an ST elevation heart attack, where the electrocardiogram shows a certain pattern, we get people into the cath lab and open up their artery. The problem is that it takes the average patient about 3.5 hours to come in. Although once they get there, we treat them quickly. So the big push in the future is going to be to have people come in quickly. It may be telemedicine. It may be some of these devices on your phone that will help diagnose. But we really need to do an effort to get people in, because if you can get them there, you can really save a lot of lives.
One of the things I was thinking about was when we talk about stroke, people that we interview will say, you might experience some small little TIA-type tremor things in advance of a larger stroke. Is there a correlation when it comes to heart attack, the coronary artery disease, that you will experience some small little precursors to a heart attack?
Yes, that's a very good question. And some of the early data actually showed that people, after they quit smoking, their risk of heart attack went up. And people didn't understand that. They said, why would that happen? And they went back and looked at those patients and found that they started getting symptoms of chest pain. And they've always been told, don't smoke, it causes a heart attack. So they quit smoking, but the heart attack occurred anyway a few weeks later. So yes, we get more tightness, pressure, shortness of breath in our chest, and we can't do the things we used to do.
When you say get them to the cath lab, what is the cath lab and what happens there?
Yeah, good question. The catheterization laboratory, catheter is the name for the small tube we put up to patients' hearts through their skin into an artery. It's an X-ray lab where you can put a tube up to the heart, inject a little bit of dye, see what artery is narrowed, and then put a balloon or a stent out there and open it up.
And how quickly do they have to get to the hospital?
Well, we'd like them to get there, very quickly. The average is 3 to 3.5 hours for a patient to come in to the hospital.
But that's still okay? You can still open up the artery?
Yes. Oh, yeah, we can still open up. Usually it's about 6 hours after the onset of symptoms. After that, you start to, may not be worth it.
All right. Still chew aspirin after you call 911 if you think you're having a heart attack?
You bet.
Elephants on your chest?
You're right. Exactly.
All right, we're talking with cardiologist and heart prevention expert, Dr. Stephen Kopecky of the Mayo Clinic. Time for a short break. When we come back, we've got a myth or matter of fact.
Women are more likely to die of breast cancer than they are heart disease. Myth or matter of fact? We'll find out. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
We are back talking about heart disease and heart disease prevention with an expert from the Mayo Clinic, Dr. Stephen Kopecky. Myth or matter of fact?
Women are more likely to die of breast cancer than they are heart disease. Is that a myth or a fact?
That is interesting. That is a myth. At any age of life, a woman is more likely to die of a heart attack than she is of breast cancer, whether she's in her 20s or in her 80s.
When it comes to that stereotypical Dr. Shives had mentioned before the break the elephant on the chest, the Hollywood-type heart attack. Though women are less likely to have that, or are both men and women less likely to have that?
Well, women are less likely to have that throughout their life. Men are less likely to have that after age 65. And so you have to pay attention to the shortness of breath. The symptoms, I'd eat something, is it I have indigestion.
So a woman's heart attack is a little bit trickier to diagnose?
It can be tougher to diagnose, and we have to rely more on objective testing, electrocardiogram, blood tests.
But if there's any question about it, call 911, chew, how many aspirin? 2?
Well,
4?
4, we call it adult low dose now,
Yeah.
or 1 regular, which is 325 milligrams.
Okay, and what's the rationale behind that?
Well, that it works within 45 minutes on working on your platelets, which are small cells in your bloodstream that clot. It stops that from clotting, and it actually helps reduce the chances of dying from that heart attack.
So you've already got the clot, but it keeps it from progressing?
Correct.
Okay. All right, risk factors again. And I don't remember you mentioning diabetes, but diabetes and obesity I know are huge risk factors. And I think you told us a year or two ago that more than 50% of the people who come into the emergency room now with a heart attack have diabetes. Do I remember that correctly?
Yeah, it's very common, and it's going to be more and more in the future as we get more obese and less active.
But diet number one.
Diet number one.
You talked about cholesterol. The statins have been around for a long time.
Right.
Still safe in your mind?
Still safe. There's always this question of diabetes, and it does seem to bring diabetes out earlier, about 3 months earlier if you're on a statin than if you're not. But for every patient that develops diabetes, there are 5 less heart attacks.
High blood pressure, you mentioned that also?
Yeah. High blood pressure, diabetes, smoking are still there. They're 2, 3, and 4 for the risk factors. But number 5, and coming up quickly, is sedentary lifestyle.
What about the hereditary component?
Hereditary is interesting. It is a big factor. If your dad had a heart attack at age 45, you're at risk. However, our lifestyle can modify our response to our genes.
Certainly, because families, their lifestyle is very similar to each other as well.
Exactly. And we looked at paired twins who were born identical and separated very early on. The one that had the bad lifestyle has a heart attack a couple of decades earlier than the one that has the healthy lifestyle.
Exercise a big deal, and I know you've mentioned before about interval training. Are you still a big fan, and why is that good?
Interval, there are 3 great things that happen within seconds of doing an interval or going hard. One is your muscles tell your heart pump more. The heart likes that. The muscles tell the blood vessels get bigger. I need the blood. But the great thing is the muscles tell the fat that we all develop, except for you, Tom, and Tracy, as an adult, is that I am running for my life. We're running from a saber-toothed tiger. I don't know why they're telling me to run like crazy, but I'm a muscle. I don't have a backpack with a bunch of granola bars in it. I'm just using all my energy. You've got to pay me back later, fat. So when we're through with this, if we survive, you've got to break down and send me energy packets.
So interval training, explain for our audience exactly what we mean by that.
Well, there are 3 concepts. One is once you warm up, go hard. Go hard enough that you say, this is really hard. You could be swimming, swim a hard lap. You could be on a bike. You can be running, whatever. Tennis is a great idea, the interval. The second thing is don't go too long. Just go like 60 seconds. If you go too long, you can't go that hard. And the third thing is when you slow down to get your breath back, fully get it back so you can go just as hard next time.
And is there a heart rate at which you ought to shoot for when you're exercising, depending on your age?
There really isn't. It's more of a perception of how hard you're working, because we can be on medicines that slow our heart rate. Some hearts go faster than others. Just make it feel like you're really going hard. It's a perception.
Let's talk about some alternative measures for heart disease prevention.
Yeah,
and what I want to ask
oil.
you,
It's fish oil 101.
Yeah, fish oil.
Fish oil. What a great thing to take. I took mine this morning. My wife, we both take it. Once I told my wife it reduces wrinkles, I have to buy twice as much. There's dermatology literature
Is that you
for
put
that.
topical, or you take that by mouth?
No, it's a pill, Tom.
Yeah.
But try to get 1,000 milligrams of the 2 active ingredients added together, which is EPA and DHA. The bottle on the front will say 1,000. You have to turn it on its side and read the active ingredients.
And it doesn't matter if it's the burpless kind or not?
No, it all should be burpless,
Okay.
because the fishy taste is separate from the good compound.
All right.
What about NSAIDs, anti-inflammatory medications that a lot of people are taking? I've seen some warnings that maybe they're not good for your heart.
That's true. That it does affect these platelets, these cells that clot easier. And so what it's been shown actually is that celecoxib, which was the one that was taken off the market at high dose.
Is that Vioxx?
Yeah, at 200 milligrams a day is probably a very good one to take. Naproxen, indomethacin, those aren't as good.
What about vitamins? I've heard you talk about them before. It seems like which one you ought to take for what changes from day to day or week to week. What are vitamins are good for the heart?
The vitamins that are good for the heart, there's been a lot of talk about vitamin D. If you get sunshine, you're in good shape. We don't get it much up here, so D may be helpful actually, especially if your levels are low. Vitamin C and E actually in high doses, not multivite, but higher doses are actually not good for the heart. We tell patients not to take vitamin C and E at high doses. And then beta-carotene, the stuff found in carrots. Eating a carrot is good, but don't take a high-dose beta-carotene. That's also bad for the heart.
Can you get all of these in a daily multivitamin?
Yeah,
or do you take them separately?
Multivitamins are fine. That dose is a reasonable dose. When they've done the studies, they don't show any benefit, but it also doesn't show any harm.
Back to statins, one more question. I recall some years ago you mentioned that most of the cardiologists here at the Mayo Clinic are taking a statin, and there wasn't such a thing as too low a cholesterol. Still believe that?
No, I don't, and I may be a little at odds with the pharmaceutical company, in that they say we can push it down to an LDL of 10 or 20. Let's do it. I say that below 30 we ought to stop there, because the cholesterol is used to make other hormones like progesterone, estrogen, aldosterone, cortisol, and we need to make sure that it's safe. So don't go below 30.
So you don't need to take a statin, but you should take some fish oil every day.
Unless you eat fish 3-4 times a week.
Gotcha.
So what's your criteria for giving someone a statin? At what cholesterol level?
Well, the guidelines say that if their risk is over 7.5% at 10 years for having a heart attack, failure, non-failure, or a stroke.
And you can figure that out by asking some questions and family history, et cetera.
Exactly. Then consider a statin.
All right, and there is such a thing in your mind as too low a cholesterol. Be reasonable with how much you take.
Yeah, if you look at the Tsunami Indians in South America, they have the healthiest hearts in the world. It's been shown by CT scans. They don't develop calcium. Their average cholesterol is actually in the 80s, their LDL cholesterol. So, we don't all need to be on a statin. Our lifestyle is so much more important.
All right, and fish oil you like, but you got to look at the side of the bottle and make sure you've got EPA and DHA in there.
Equal up to about 1,000, right?
All right, every day.
Got it.
All right, Dr. Stephen Kopecky, cardiologist and an expert in prevention of heart disease, Mayo Clinic in Rochester. Thanks again for being with us, Dr. Kopecky.
Thank you.